Okay, welcome to this special press conference for the Winter and COVID-19 response in Northamptonshire. My name is Catherine Hall. I'm Communications Manager at Northamptonshire Healthcare Foundation Trust, and I'll be chairing today's meeting. I'll just run through a couple of bits of housekeeping before we begin. If you, as stated, could just please remain on mute until you're invited to ask your questions or speak, that would be fantastic and reduce any feedback. Unfortunately, we're not able to live stream today, but we will upload this recording as soon as we can after the meeting, and we'll send copies around to media colleagues. Most of you will be familiar with the format of these conferences, but just as a reminder for anyone who's not, the first half of the conference will be made up of our situational updates from each of our panel members, and the second half is where we will invite our media colleagues to ask their questions to the panel. We are delighted to have representatives on our panel from all areas across health and care across Northamptonshire today, and I'm really like to thank all of them for their time. So just to introduce our panel, we've got Toby Sanders, Chief Executive of the Northamptonshire Clinical Commissioning Group, Lucy Whiteman, Director of Public Health from North and West Northamptonshire Councils, Chris Pallow, Programme Director for the COVID-19 vaccination programme in Northamptonshire, Dr. Joanne Watt, GP Chair for Northamptonshire Clinical Commissioning Group, Matthew Metcalf, Interim Chief Operating Officer at Northampton General Hospital, Michael Jones, Divisional Director for East Midlands Ambulance Service in Northamptonshire, Stuart Lakenby, Executive Director for Adults, Communities and Wellbeing at West Northants Council, and Andrakam, Director of Mental Health at Northamptonshire Healthcare Foundation Trust. And also in attendance, we have Superintendent Sarah Johnson from Northamptonshire Police. I'll now hand over to Toby Sanders to open today's conference.
Good morning. Thank you, Catherine, and thank you everyone for joining us. My name's Toby Sanders. I'm the Chief Executive of NHS Northamptonshire. You're joining us this morning at a really critical point in the last 2 years. We've all lived through and all learning to live with the frustrations and challenges of the pandemic over the last 2 years. And yet arguably sat here today, we are at the most critical point in the whole of that last 2-year period. We've all got to a stage of learning to live with COVID and live with Delta. And from a health and care perspective, we've seen things starting to stabilise more across the county over recent months. And what, as we've seen nationally as well as locally, has really changed all that in the last few weeks is the development of Omicron and the new variant. And it is the speed of transmission that we are seeing of the Omicron variant, which is presenting the real challenge to all of us in terms of how we respond over the coming weeks and months to this. And whilst there is still so much that we don't know, and Lucy, our Director of Public Health, will tell us more about this shortly, but whilst there is still so much that we don't know in terms of particularly the severity of the virus, what we absolutely do know, and the scientific and medical community nationally is absolutely in consensus on, is firstly that this new variant is spreading and is much more transmissible than we have seen with previous variants. And you can see that in the scale of numbers and the rapid increase, almost on a doubling point now every 2 days or so. And secondly, we know that notwithstanding the huge success of the vaccination programme, and Chris Pallow will tell us more about that again from a local point of view shortly, we know that the current vaccines with 2 doses give much lower levels of protection against infection with the new variant. And that's really put the importance of the booster programme absolutely at the centre of our response to this over the coming period. And so whilst there is much that we don't know about the severity and is still to be kind of worked through, what we are absolutely now certain of from a modelling and a planning perspective is that we expect the coming days and weeks to become incredibly challenging simply because of the sheer volume and scale of numbers of new cases and infections that we expect to see across our county. And the backdrop set against this makes this doubly challenging for us from a health and care perspective, because we're in a very different place to where we were at much of the point during the last calendar year from a health and care perspective in terms of services. As we're sat here today, over the last few weeks, most of our health and care services across the county have already been running at pretty much full capacity. We'll hear later on from Matt Metcalf from our acute hospitals in terms of the pressures that our hospital services are currently under, our ambulance services, our adult social care services across the county. So most of our services have been running at pretty much full capacity over recent weeks. I was personally on call over last weekend and really in very challenging sort of hour by hour conversations with colleagues about how we manage and keep patients safe and support our staff through this period. And that really is a reflection of the pressures we've seen in terms of returning to normal levels of service, in terms of ongoing infection prevention and control arrangements, in terms of our workforce supply challenges, which, we're not immune to this from a health and care perspective. We face the same challenges that all businesses and all sectors do in terms of workforce availability, particularly with people isolating and illness at the moment. And so that heightened level in terms of current operational capacity and the normal winter pressures we see really means that the margin that we have across the health and care system to be able to cope and respond to what we anticipate over the coming days and weeks to be a very rapidly increasing position in terms of Omicron cases really puts us in a very, very critical and challenged position. Now, I can sit here today with real confidence knowing that we've got partners across Northamptonshire who are working together brilliantly to do everything that we can, once again, to support our population, keep people safe and support our staff. The booster programme is ramping up dramatically during the course of this week. Chris will tell us more about that shortly. Yesterday, we saw the biggest day in our booster programme across the county with more than 10,000 vaccinations delivered, which is tremendous reflection of the huge contribution our GPs, our community pharmacies and our other providers are making to the programme. We're also alongside that, and we'll hear more about this later, doing everything we can to try and create capacity within particularly our acute hospital services in order to make sure that we've got the bed capacity to be able to support those patients who we anticipate are going to require a level of inpatient support and care. But we have to be honest and recognise today that doing both of those things is going to mean some difficult choices about other services that we are going to have to slow down and step down as we prioritise putting our clinical and professional staff into those areas that can enable us to roll out the booster programme at the speed we need to, and to be able to create the capacity to give us some headroom to be able to absorb the demand and pressure we expect to come our way over the coming days and weeks. And we need to ask the public and our local population to bear with us and to recognise that our teams are going to have to make choices in those situations to make sure we can put the capacity where we need it. So we are doing everything from a health and care perspective with partners across the system, and we'll hear more of that shortly. But we need to ask once again our local people across Northamptonshire who have responded so tremendously over the last 2 years to once again come with us on this over the next few weeks and months. We absolutely need people to do their bit. We need people, if you haven't had it, to come forward for that booster jab. I had mine earlier on this week. I know we've got very slick arrangements in terms of how people can book. We've got so many options across the county, from local community pharmacies to our large vaccination centre at Malton Park in Royal Pavilion. So really, we need people to come forward and take up that offer and get yourselves booked in if you haven't had that. And if you still haven't had a first or a second jab, absolutely, we're still there for you as well. And then secondly, and you heard Chris Whitty, our Chief Medical Officer, nationally speaking to this last night, we also need to ask people once again to think carefully about their interactions and their social mixing. We know that this is a virus which is spreading, and this variant, so much more rapidly than previous variants we've been living and working with. And for that reason, the choices and decisions we all make over the coming days and weeks will make a real difference to our ability to support our local population, our staff, and keep people across Northamptonshire safe. Thank you, Catherine.
Thanks, Toby. So it seems most relevant to go to Lucy Whiteman first, our Director of Public Health, for an update on COVID and Omicron.
Thanks, Catherine. So I'm sure people will have seen the local stats. They really sort of speak for themselves, but across all of our age ranges, we've got quite a varied picture, fluctuating quite high spikes, but also changes and some reductions in some age groups. The overall all-age case rate, though, particularly in West Northamptonshire, is going up and has had around a 9% increase in the last 7 days. In North Northamptonshire, we've actually seen a slight drop, obviously from a higher starting point about a week ago, so around a 10% drop in our case rate in the last 7 days. But that hides within it some real fluctuations, as I said, within different age ranges. The one thing that we are seeing that is beneficial is a more recent drop in the over 60s case rate. And that will be, as Toby's just alluded to, the effect of the fact that we rolled that booster programme out for that older age group that little bit earlier, and most of that population now has had that booster. So you're starting to see that reflected in the case rate coming down, and just, you know, as I said, reinforces the efficacy of that third dose. What we are still continuing to see, though, as I said, is a great fluctuation between the different younger age groups in particular. Omicron seems to have affected our 0 to 4 age group much more so than some of our other age groups in previous variants and previous waves. Part of that will be because obviously other age groups have now got more vaccination protection, but part of it will be obviously restrictions around trying to isolate little ones obviously is so much more challenging. So we do recognise that there are some real difficulties in stopping that, particularly household spread, when you've got very young children who are affected by this. But our case rate in West Northamptonshire as it stands today is 636.3 cases per 100,000 as a rolling 7-day average. In the north is 524.2. Now compare that to England at 527. You can see North Northamptonshire is broadly comparable. West does continue to be an outlier. The East Midlands rate is a little below the England average, but as I said, West Northamptonshire is one of those areas that's been significantly affected. Now, one of those reasons is we are indeed case finding. West Northamptonshire's test rate, for example, at the moment is 710.2 tests per 100,000 population as a rolling 7-day average, much, much higher than the East Midlands average at 639.4. So we are obviously testing areas and communities where we know we have high prevalence, and indeed we know where Omicron is actually also very prevalent. From a point of view of the exact Omicron numbers, now cumulatively in West Northamptonshire we've had 140 confirmed cases. There are 195 probable cases and 2 possible cases. Now that data obviously changes day to day, and as we know, the actual real size of the Omicron variant numbers is going to be much, much higher because only a small sample of our actual tests go and get full genomic sequencing. So this is probably the tip of the iceberg, as we know that Chris Whitty has already alluded to as well. In North Northamptonshire, we've had 24 confirmed cases. We've got 89 probable and 4 possible. So we are, you know, one of the areas, and certainly in West Northamptonshire, with higher case numbers. We identified a cluster very early on that was one of the first cases that wasn't directly associated with travel, and therefore was demonstrative of the fact that there was already community transmission. And off the back of that and other areas finding similar issues, we obviously saw changes in the government approach and a recognition that obviously we couldn't contain this from a point of view of closing borders. But what we do need people to do, as Toby's already suggested, is really just be sensible. We don't want people to panic, but at the same time, we've got to recognise that this is a very real and immediate threat. COVID itself obviously continues to affect different people differently. Some people will have mild symptoms. Other people, obviously, this ends up being a very fatal virus and can be passed on very, very easily, as we know at this point as well. So you've got to recognise that even if your own experience of COVID, and particularly the Omicron variant, is mild, it may affect somebody very close to you very, very differently, and you have to therefore act appropriately and cautiously. Just because you can, as we've talked about before, doesn't mean that you should. And obviously the government are trying desperately not to enforce any more stern measures, but at the same time, if people don't exercise some level of common sense and restraint around who they're mixing with, how frequently, particularly coming up to Christmas, we obviously may see that having to be considered, which I'm sure is something we would all want to avoid. We recognise the mental, economic and physical health impact of further restrictions. But as I said, we've got a stark warning here. West Northamptonshire in particular affected by the Omicron variant. The picture across the whole of the region is startling. We're seeing case numbers double in roughly 2 days. And as Toby's already suggested, this is on top of what was already a very, very pressured system. We don't want people to end up, you know, needing urgent care and finding there isn't the capacity. So everything we can do as individuals to stop the spread and to relieve the pressure and protect ourselves and others is what we've got to do over the coming weeks. Thanks, Catherine.
Thanks, Lucy. So the man leading the vaccination programme in Northamptonshire is Chris Pallow. He's going to talk to us about the vaccines and how you can access them. Chris.
Thank you very much. Good morning, everybody. So my name's Chris Pallow, and as Kath has already said, I'm the director in charge of the programme in the county. The challenge that's facing Northamptonshire as a result of the announcement the Prime Minister made in the acceleration of the programme is to deliver an extra 250,000 boosters by New Year's Eve for our population. We've made a really good start already. 87% of our over 80s have been boosted, and over 90% of our 75 to 79-year-olds have been boosted too. So that is a position of strength to commence this charge towards New Year's Eve, and it's easy to conclude that it's our younger population, because they had their second vaccinations later, that we now need to focus on. So the majority of those that will need to be boosted very quickly before New Year's Eve are in the 18 to 50 cohort, but there are some in others too. So how are we going about that? We've made a good start already, and only the day after the Prime Minister's announcement, we doubled the number of boosters delivered across the county, and we did the same on Tuesday. As Toby has already said, yesterday was the largest day for the booster programme that we've had so far, and it is going to accelerate considerably as we go towards the weekend, and our colleagues in primary care in particular are laying on many more extra clinics. Next week, we'll see the largest delivery of vaccines into Northamptonshire that we've seen at any point in the programme, and that's going to enable us to accelerate even further. We are delivering this task in the main through our existing pillars of delivery by expanding capacity and expanding the hours that we're open. So our main vaccination centre at Moulton Park will be offering more appointments later into the evening and more appointments during the course of the day. One really important thing has changed during the course of this week, which is that patients temporarily will not have to wait for 15 minutes after that vaccination. That will enable us to increase capacity across all of our pillars, and is particularly helpful for those areas which have got slightly smaller footprints and which were constrained at their throughput by the number of patients having to wait. So that is really very positive news. Our community pharmacists are delivering more vaccines than they ever have before. And at the end of this week in particular, our GPs will start to add in extra clinics, and the majority of the vaccinations that we predict will take place will be delivered once again by our colleagues in general practice, by freeing up their staff, freeing up their time, and dedicating even more resource to this task. So we have a number of ways in which our patients can access the service. The first is through the National Booking Service, either online or by dialing 119. We have slots available now and into the future through that service across the county, and we have 25 sites that can be booked through that route. Our general practices, we have 16 primary care networks, which are groups of GPs who work in partnership, and every single one of those is providing vaccination as well. And many are not just providing it through a hub within that geographical area, but are also transferring vaccines to their constituent practices to give even more choice to their patients. And then finally, we're offering pop-up sessions and walk-in appointments as well. So if patients can't make an appointment, they can access a service at a time that's convenient to them simply by turning up. I would ask people to look either at the National Grab a Jab website or our local website, which is northamptonshire.gov.uk, which lists all the opportunities for patients to walk in. The whole principle behind what we're doing is to give people as much choice as possible so that we can get this vaccine into as many arms as possible by New Year's Eve, and therefore try to combat some of the issues that we have that both Toby and Lucy mentioned some moments ago. Thank you, Kath.
Thank you, Chris, and thank you to your team and everyone involved in rolling those jabs out. Massive job. We're going to go now to Dr. Joanne Watt, GP Chair for Northamptonshire Clinical Commissioning Group.
Thank you. So I think from the point of view of what my colleagues have said before, really I'd like to add my emphasis to thanking everybody that's been involved in the vaccination programme, particularly the volunteers and the many staff that have stepped up to do this really, really important work. And obviously some of the general practice teams will particularly be focusing on this in the next couple of weeks and maybe redeployed from one of the things that they're normally doing. We'd really like to thank the general public. If your routine appointment has been postponed during this time, thank you for your patience. Please be kind to the general practice staff. They are focusing on this work. You will be contacted again when there's the opportunity to do that. But we do know that some things may be postponed just for a few weeks. You may have received a text from your general practice, and if you have and you have an urgent query, you may wish to speak to 111 or your local pharmacist, who will be able to give you more information if you are not able to obtain that from your general practice. If you still need urgent attention from your GP, including the face-to-face appointments that have been offered throughout the last pandemic, you can still contact your practice. They are still there and available for you, but there are other sources of information as well. There are things that you can do to help yourself during this time, and in particular, as we come up to the festive season, we always see people who have run out of their medication at the last time, or who don't have simple home remedies in. This is a really good time to make sure that you've got paracetamol in your medicine cabinet. Make sure that you've got a thermometer so that if you need to speak to a health professional, you can tell them if you or a loved one has a temperature. Make sure that you've got things ordered in, and this is a good time to order your medication if you are going to run out over the festive period. To emphasise what my colleagues have said, if you start to feel unwell, if you think you have a bit of a bug, whether it feels like a cold or a sinus infection, or you think you might have a bit of flu, it is really, really important to get a COVID test by calling 119. We still have a lot of our public who feel that they would know if it was COVID. They wouldn't. For a lot of people, it just does feel like a cold. And the benefit of getting a test is, particularly if you're high risk, your general practice will offer community monitoring. What that involves is lending out those people who are at higher risk of hospital admission an oxygen saturation meter that will allow your practice to keep an eye on you and take timely action. But it will also reassure you if you're fine, you can stay isolated in your community, but you don't need to go to hospital, and that will free up the accident and emergency capacity for those people who really need it. It is important to be kind to the staff that are experiencing pressure across the system, so across the health and care system. We appreciate that people are really frustrated. We know that a lot of procedures and operations have been postponed, and we know how hard all of our colleagues are working across the system. We are sorry that those things will be postponed a little bit longer, and we really thank you for your patience, but please be kind to the people who are looking after you at this really difficult time. Stay well, stay safe. Just because you can doesn't mean you should, and I think it is really important to continue to protect you and the loved ones around you, to do lateral flow tests if you have no symptoms and you must go out and socialise. Please do lateral flow tests in that situation. But if you have symptoms, lateral flow tests are not sensitive enough and certainly will not detect if you have Omicron. So if you have symptoms, it is a PCR send away test that you need to do. Please don't use your lateral flow test for that. Look after yourselves, look after each other. Thank you.
Thank you, Jo. Thank you to you and your colleagues and everyone in primary care, again, working so hard. We're going to hand over now to Matthew Metcalf, Interim Chief Operating Officer at Northampton General Hospital.
Thank you so much, Catherine, and thank you for the opportunity to speak on behalf of both Northampton and Kettering General Hospitals. It would be fair to say, as colleagues, and in particular Toby has already alluded to, both of our hospitals are extremely busy at the moment, caring for emergency patients in particular, both those with COVID and indeed non-COVID conditions. To try and to put some context around that, between both hospitals, they're seeing an average of around 700 patients per day in their emergency departments at the moment, and that's a full 10% up on the year before the COVID pandemic hit us, which was in itself a busy year. So a significant increase in emergencies presenting to our departments. And our teams have done a magnificent job of caring for that. But regrettably, in order that we can prioritise those patients who need our care most, there has been some knock-on effect in terms of cancellation of or postponement of some routine operations, some outpatient clinics. And I'd like just to take this opportunity to say on behalf of both hospitals to the the patients who are affected directly by that I'm sorry, and these decisions have not been taken lightly. It is purely so that we can focus our team's efforts on those patients who need us most at the moment, and we will never forget about you, and we will bring you back as soon as we possibly can and reschedule your appointments and your procedures. The pressures on the hospital, of course, I've talked about the general increase in workload from emergency presentations. There is a specific added complication with the COVID patients that are in both of our hospitals at the moment, not least because in order to keep non-COVID patients and our staff safe, we need to quite strictly segregate the care of COVID and non-COVID patients, which does make it an awful lot more tricky to move patients safely through the emergency department and into beds without any risk of cross-infection. Just to put some numbers on the situation. If the numbers in each hospital fluctuate from day to day, but roughly at the moment there are 60 patients in each hospital with a diagnosis of COVID. That number had been stable for a few months, going up and down a bit, but over the last week or so, those numbers are starting to rise, and we have started to see Omicron COVID patients in our hospitals. Staying on COVID just for a moment more, those patients who get really sick with COVID, really sick and need critical care, need ventilating, those that sadly die, unfortunately the majority of those are unvaccinated, and I therefore would be remiss of me not to take the opportunity to echo in the strongest possible terms the messages you have heard from all of my colleagues so far. Please, if you have not, get vaccinated, and if you have been vaccinated, get your booster. The other recent change that the hospitals have made, not just because of Omicron, but certainly Omicron heightens the need for it, is that if you are visiting a patient who is in our hospitals, you will need to demonstrate that you have a negative lateral flow before you come in. This is because some of our recent outbreaks in hospitals have been traced back to completely unwitting and unintended actions of visitors who were unaware that they had COVID, and that creates a significant risk to our patients in particular, but also our staff. So apologise for the inconvenience of that, but I hope you will understand why it is necessary, and help us to keep your loved ones and other patients safe. So final request from me to all of you would be that we are always open if you need us, and if you need us, then come and we will look after you. But if you have a minor illness or injury, then please call NHS 111 or seek help from your local pharmacy, or call your GP practice with the kindness that Joe has already asked for. And I need to say that if you do attend an emergency department with a minor illness or injury that could be equally well treated elsewhere, then we may have to turn you away so that we can focus on caring for those patients who most need hospital care. Thank you very much.
Thanks, Matthew. Thank you for those important messages, and again for all the work that you and your staff are doing. And we're going to hand over now to Michael Jones, Divisional Director from East Midlands Ambulance Service in Northamptonshire.
Thank you, Catherine, and good morning, everybody. I think it's fair to say EMAS is no different to everybody else in the system, as we've just heard. We're incredibly busy, and our staff and volunteers are working tirelessly to get to the patients who need them most. The entire community has never been under so much pressure at the same time before. I'd just like to put on record my personal thanks to our staff for the resilience that's shown over the last 18 months, 2 years. Our ambulance call handlers are receiving more 990 calls than they've ever received, with daily calls far exceeding what we see on New Year's Eve, which is historically our busiest day. We've seen a significant rise in calls we've been receiving, and we've got prepared action plans for handling that demand. Just to put it into context, our Category 1 calls have risen by 40% in the last 12 months, and category 2 by 23%. Having said that, despite the huge increase in calls, our frontline staff are continuing to safely reduce the number of patients we take to hospital. This is by providing care and treatment on scene, and when appropriate, referring to an alternative pathway. This again shows collaboration with the system and working together, and ensures only the appropriate people go to hospital. And also it ensures people receive the right care in the right time and the right place. Just to put it into context on that, in December 2019, our non-conveyance rate was at 46%. Now, as we stand in December 21, we're at 58%, which reinforces the fact that we're working together as a system to get the right care to the people. Alongside this, our patient transport services are providing vital support by ensuring flow maintains through the hospital and discharging people into the community. Again, internally, what we're doing to manage our demand or increase in demand, we've actively recruited 50 more frontline staff this year, and in Northamptonshire alone. And in our emergency operations centre in Nottingham, we've got 40 more 999 call takers, again, which will help this increase in demand. So that's where we are with EMAS, but can I just make a plea for the people of Northamptonshire to help us by using the NHS wisely? If life is not at threat or condition isn't urgent, can you please visit your local pharmacy first, or NHS 111 line, or your GP? This will allow us to send ambulances with life-saving equipment to the people who need us most. If it's self-care measures, for example, over-the-counter medication and rest, or prescription medication for long-term condition, doesn't help when someone starts to feel poorly, they should really seek medical advice early. And again, 111 pharmacy or via the GP. This again could reduce the risk of the condition becoming more serious and emergency services being required. If you call 111 and 999 and told you will get a call back, it means the patient condition isn't immediately life-threatening or serious. When we ring you, you may be asked to be able to make your own way to a treatment centre. For example, a relative can take you by a car or taxi. However, if 919 is called and you do need us because life is at threat, we will come. For example, when the heart has stopped beating or the patient is unconscious, an ambulance will be on its way as soon as possible, and only call back if the patient condition has changed or you tell us you're making your own way to a treatment centre. But I think my clear message is please use the NHS wisely, but if you do need us, we will come. Thank you, Catherine.
Thank you, Michael. Again, some really important messages there. Thank you very much. We're going to pass now to Stuart Lakenby, Executive Director for Adults, Communities and Wellbeing, West Northamptonshire Council.
Good morning. So from an adult social care perspective, it's plain to say that we are incredibly busy at the moment. In fact, we're supporting people, more people than we've ever supported before. In the context of that, the first thing that I really need to do is to thank all of those health and care workers who have continued to support people over the last 2 years. On some occasions, kind of putting residents and the people they're supporting's lives in front of their own welfare and that of their families. And I think it's really important that we remind ourselves that many of these health and care workers are not going to have a break over the festive period. Christmas Day, they're going to be there in our care homes, visiting people in their homes, supporting some of the most vulnerable people within our communities. But we also need to remind ourselves that those care workers are also susceptible to COVID and to Omicron. And increasingly, when they become sick, that significantly impacts around our ability to ensure some of the most vulnerable people in our communities are supported. It's clear to see that we really struggle at the moment to kind of recruit to care workers within adult social care. And we really need to get better at articulating the career opportunities that you can have through adult social care. So big ask is that if people are interested in working in adult social care from a West Northampton perspective, if you have a look on the council's website, you'll see in the jobs and careers pages a list of organisations locally who are actively recruiting. I myself started off as a support worker, and we need to, as I've said, get much better at kind of articulating the career opportunities in and around that. I also want to say a big thank you to our families. So across Northamptonshire, families continue to provide really valuable informal support to people with care and support needs. Again, they're not likely to get a break over the festive period. We need to ask them to continue to provide that informal support they do to relatives and friends. And we need to ask them for their flexibility, because as we struggle sometimes to provide people's required care and support, increasingly we might have to ask families to support us with people's kind of ongoing care and support needs. We will be working all the way through the festive period, and there will be support available to people who need us, whether that's around keeping people safe, whether that's around supporting people to be discharged from hospital. But I'd like to say that it's likely to get really busy. And in the context of that, please bear with us, and we would ask people for their patience and their flexibility as we do our best to support people. We need to ask people to be mindful, and I think other colleagues have alluded to this, of the impact their decisions and interactions are likely to have. For me, that's particularly around the impact that that might have on some of the most vulnerable people within our communities, because we know that vulnerable people are much more susceptible to the potential implications of both COVID and Omicron. I suppose the final thing for me is just to say again, please get your booster. Thank you.
Thank you, Stuart. And again, thank you to everyone in health and social care and all the work that they're doing. Our final panel speaker today is Andrakam, Director of Mental Health at Northamptonshire Healthcare Foundation Trust. Morning, Anne.
Morning, and thank you. I think a number of people have sort of alluded it today, but we absolutely recognise the impact of the pandemic on people's mental health and well-being. We've all been through a really difficult few years with the pandemic, with changes to how we live our lives, to how we work or not being able to work, and how that's impacted on our finances and on our families, as well as the generalised anxiety and concern about the welfare of ourselves and our loved ones, and not to forget in any way those that have lost people over this pandemic. So, as a system, we recognise the importance of making sure that we have support services there. Nationally, we've seen an increase in people using mental health services because of all the things mentioned. Our psychologists will often say that we've all been through one storm of the pandemic, but we've all been in different boats, and people have had different experiences. They will have different levels of resilience at this point. They will have different sort of baggage that they carry with them from things that have happened in the past, and therefore our offer needs to be different to match what people need. The key message really around mental health is reaching out to talk. Now, that might be to people around you in your families or in your communities, but we are also there to support people. We have our mental health number. This is a 24-hour line, self-referral, anyone can call, and that is staffed by mental health staff from NHFT and from Mind Charity. I think it's important to recognise we get a high volume now. We're getting over 5,000 calls a month, and our staff will work really rapidly to work through answering those calls. We also have our crisis cafes, another offer which might suit other people better. These are walk-in cafes following infection control guidelines, and they are in our mind centres, and they can be found on our website. And this is about, some people will find it easier in times of crisis to talk face to face, and we recognise that, and we'll put provision in for that. We also have our talking therapies at IAPT. Some people prefer a more structured approach to talking, and that's absolutely fine. This can also be accessed through our website, and you can self-refer online and actually start the work online around managing anxiety and depression. I was asked to give a bit of a patient story to what does that really look like for people. So I'll just give an example of a gentleman that I met who had never used mental health services before, and in the pandemic his relationship had broken down, which is a very frequent story that we're hearing, and how he coped with that, with being on furlough, feeling very isolated, meant that he had a sort of a spiral around his negative thinking, and was really anxious about what was happening to his mind. He contacted the mental health number and was encouraged to attend one of our crisis cafes. Now, his story is that he felt that this was probably the bravest step he took, but the best step he took, to go and talk to somebody and start to process what had happened to him and reach out. He'd not used services before, and he hasn't had to use services since, but he has come back to volunteer because of the massive impact this has had on his life. We'd really encourage people to use our mental health number and to only attend the emergency department for a physical emergency. For mental health, please contact the mental health number first. We've talked a lot about the pressure on staff across our system. We are really proud of everybody working on the front line. The people that work in all of our organisations are dealing with all of the concerns that we have in our homes, as well as coming into work each day and often being asked at the moment to do jobs that they don't always do, and going that extra mile. So we'd really encourage you to really extend that kindness. If there is a wait or there is a change in direction, then please support the staff in making those really required changes. We have put on psychological services for our staff, recognise the importance of talking, and that will continue for some time to come. Thank you.
Thank you, Anne. Some really important messages there, and we'll make sure that the number is circulated around afterwards as well, so that people can access that. Toby, would you like to give a very brief summary before we've got a number of questions to come through?
Kath, I will, but I'll be incredibly brief because it's really important we get to the questions and to the conversation. I think the only thing I would say, I guess, in sort of summing up is what you've heard from all of us is we are at a really critical point in this. We are expecting cases and numbers to increase very significantly over the coming days and weeks. That will put real pressure on all of our services. We are already very busy and therefore have very limited flexibility in that. So we're doing everything we can, booster programme, creating capacity where we can across our different services. But we really need the local people of Northamptonshire, again, to step up and work with us on this. Get yourself vaccinated if you haven't already been, whether it's your first, your second or a booster. Use services really carefully. Think about your mixing and your social contacts. And please bear with us if we have to postpone or reschedule things because we're having to redeploy teams into other areas. We can get through this and will again over the next period, but and none of us want to be having this conversation again in the run up to another Christmas, but it is the reality of where we are, and we anticipate it's going to get more challenging before it eases. So please do those things that can help all of us to support each other to stay safe and stay well. Thanks, Kath.
Thanks, Toby. So we move into the section where we take questions for media. So I'd just like to ask the panel if we can be succinct in our answers so we can get through as many as possible. That would be grateful. Thank you. First question is from ITV Anglia. Do we have David from ITV Anglia? Anyone representing ITV? If not, we'll move on. Okay. Next one we've got is from Sam Reid from BBC Look East. Sam, are you on the call?
Hello, yes, hopefully you can hear me. All right.
Yes, go ahead.
You've discussed how parts of Northamptonshire have the highest rates of COVID in the country at the moment. Why are those rates so high here, and how does Omicron play into that? And I wonder, given rates are so high in parts of Northamptonshire, should the public be going above the restrictions and the advice that has been given by the national government? That was really for Toby and Lucy, I suppose. And just one question for Superintendent Johnson. What are your plans to enforce the slightly tighter rules that came up this week? And have you been given any guidance from the government on that?
So if we come to Lucy first to deal with the first question.
Yeah, thanks very much for the question. You're quite right. As always, we have a really mixed picture in Northamptonshire, and that's actually been a feature of the pandemic throughout. So unusually, though, our case rates, as you quite rightly say, are highest in South Northamptonshire.
I'm really sorry to interrupt. Just the only way I can use this answer on telly is if you, I can't actually see you on my screen. Is there any way anyone can press any buttons so that I can actually see you? Sorry to interrupt.
No, that's fine. Thanks. Hopefully, Sam, you can see me. Yeah, so you're quite right. At the moment, we've got a huge variation across Northamptonshire, which, as you know, has been a feature in Northamptonshire. We've tended to almost reflect the whole country's differential rates just in our one county. Unusually, though, South Northamptonshire is the focus, and the case rate there at the moment in the last 2 weeks is around 816.8 cases per 100,000. So, you know, quite alarmingly high, you would say. I think one of the caveats I would add to that is that we are doing a lot of very specific and focused work with that community. Obviously, it's where Brackley is located, and people will know that that obviously is where one of the clusters for Omicron was first identified, that was specifically related to community transmission. So by the time one case was identified, we did the contact tracing with our partners at the UK Health Security Agency, and it was clear there were a number of associated cases. When we then did some targeted testing within some settings that were quite common locations for the cases we identified, again, we sort of had cast that net a little bit wide with our testing and found more direct cases. So we've done some very specific testing regimes there, and therefore we have been case finding very specifically. You'll find that's also one of the characteristics of the other areas where Omicron was identified in that sort of first wave of cases. So yes, it is high, but as I said, there are some reasons for that. We've also got a very responsive community there who raised, you know, recognised the risk and raised themselves to that challenge about making sure that they did get themselves tested and indeed been isolating as required until obviously those isolation rules changed recently. Compare that to Northampton, which is one of our more densely populated areas where the case rate is 462.3. So big variation, some very obvious reasons for that being the case, particularly in South Northants. But as you suggest, you know, we are pleading, and I think, you know, just so that we're not too subtle about it, as we may have been earlier, for people to, you know, look at how they can restrict their movements. Dr. Chris Whitty has already suggested that that is indeed what would be sensible coming up to Christmas. And our case rates would also reflect the fact that actually the more we can limit our communication, our contact prior to Christmas with people, the less likely we are to see these numbers increase any further. So in case we were too subtle earlier, yes, we would be recommending that people exercise caution and common sense, and therefore go perhaps further over and above some of the required restrictions and just look at how they can help protect themselves and those that they care about over the festive period.
Thank you, Lucy. And Sarah, are you able to take the second question, please?
Yes, happily. Thank you very much for the question. In terms of the response from the police, police forces are looking, and Northamptonshire Police is looking to increase visibility, specifically in high risk and crowded areas, as you would normally expect that we will do around the Christmas period when we have an increased type of footfall, but also specifically in support of the coronavirus regulations. So our towns, shopping centres, transport hubs, if we do encounter people who aren't wearing face coverings, particularly on public transport or in shops, then we're really looking to engage with them, explain the risks, and really encourage them to comply with all of the new rules. We will continue to enforce the coronavirus regulations wherever it's necessary for us to do so, and particularly in terms of supporting the retail sector and transport hubs with wearing face coverings in line with the regulations. And we're really working closely with our partners and businesses, and particularly to respond to any incident where individuals might perhaps be violent or abusive towards staff or members of the public if they make challenges associated with it. In terms of guidance from the government, absolutely, as you would expect with such a massive response from across the public sector, we have guidance that comes out every time that we have changes in legislation. And we also have specialist support from places like the College of Policing and the National Police Chiefs Council to allow us to communicate, to talk about the changes as they come through, and to ensure that we have a shared and common understanding of how we're looking to support our partners, but also to ensure that we deliver a consistent approach in responding to those regulations. Thank you.
Thank you very much. Our next question comes from Carly O'Dell. Carly, do you want to ask your first question?
Hi, yeah, sorry. It's to Chris Pallow. He did touch on it in his brief beforehand, but I just wanted to ask again about that end of the year target for vaccines and for the boosters, sorry, and for how many we've got left to offer 1, 2, and what we're looking like to be able to get those offered by the end of the year in Northamptonshire, please.
Thank you, Carly. So the latest figures I've got for the number of boosters we've delivered is just over 268,000. And as I mentioned rather in the introduction, the remaining population was around about 250,000 to deliver boosters to by New Year's Eve. We've made a really good start, but most of our capacity, the bulk of our capacity, which will be delivered in GP surgeries, is coming on stream now towards the end of this week, with additional clinics being put on since the Prime Minister's announcement. We're expecting a large delivery of vaccines into the county tomorrow and a very large allocation for the remainder for next week. So I'm absolutely confident that A, we've got the capacity in place across our community pharmacies, our GPs and our vaccination centre, and B, the supply of vaccine coming into the county is going to be sufficient to ensure that that offer is made to every single person. Echoing previous messages, we've got the capacity in place. We've got wonderful volunteers and staff that are freeing up their time to support us, and the opportunities are there for the population to access the vaccine in a variety of different ways. So I'm very confident that we will make the progress that we need to make.
Thank you, Chris. Just in order to be fair to media colleagues, I'm going to jump about so everyone's had the chance to ask some of their questions. So I'm going to come to Max Pearson next. Max, are you on the line?
Yes, hello. So this question is to Toby Sanders and Lucy Whitman. Is Omicron a, quote, milder version of COVID, and are the symptoms different?
Lucy, do you want to give your view on this one?
Yeah, so to be clear, the real answer is we don't know. We still have got a relatively small sample size, let's be honest, in the grand scheme of things. And at the moment, therefore, we need to be exercising caution as our Chief Medical Officer nationally is asking us to do, and all of the other scientists that have been involved in assessing the current impact. I think one thing that we can't underestimate is even if the symptoms end up being slightly milder, the sheer number of cases that we are seeing mean that the sheer number of people that are likely to end up needing primary care support, secondary care support, adult social care support, etc., is going to increase. And on an already pressured system, that is something we just cannot afford to happen. So I would just say, no, at the moment, we don't know categorically. And my word of warning is that even if it do tend to be milder, we still will see a significant increase in pressure on an already overextended system.
Thanks, Lucy. I'm just going to keep rotating round and we'll go through as many of these questions as we can, as we do need to finish by 12. So I'll come next to Global. Have we got a colleague on the line from Global?
Hi there, Catherine. Hi, everyone. Thanks for putting this call on. My name's Lily. I'm here on behalf of Heart Radio today. Sorry, I know you have partly answered these questions already, but it'd be great if you could succinctly just give us a couple of lines on each of them once again. First and foremost, what is the current projected booster take-up in Northants looking like at the moment? Shall I go through the other two, or shall I? I'll go through.
If we can leave this on for now, and then we'll come back to them if we can. That would be great. Thank you, Lily.
How is the NHS coping? Are there any local problem hotspots with hospitals and ambulances being able to respond? And do you have, this is kind of changed overnight, all things considered, but do you have any advice for Christmas office parties yet to take place, or nights out and family gatherings also yet to take place in light of last night's guidance? Thank you.
Chris, if we come to you first and then Joe.
Yeah, so you said what's the current level of booster uptake projected? So we're projecting to hit the challenge that's been put before us by the Prime Minister, and pulling out all the stops to do that. The current uptake, whilst we're sat here, and the latest figures that have been made public, for the over 80s, we're at 87%. For the over 70s, we're over 90%. And as you come down through the JCVI cohorts, that number reduces for understandable reasons, because we've yet to get to that population, because they need to be 91 days after their second dose. So I won't go through the figures anymore, because they are included in the publicly available information, and you'll be able to get it from there.
Thanks, Chris. Joe, did you want to add a line to that?
I think the only thing that I'd like to add is to really thank everybody that's been involved within it. Everybody is working so hard to get these figures, to get everybody vaccinated within Northamptonshire, volunteers and all the different venues, and just to give my heartfelt thanks to everybody who is making this a reality. This is really, really important. Thank you.
Thanks, Joe. I'm just going to come to BBC Radio Northampton before we rotate and see what we can get in. So I think it's Craig on the line. Or I'm happy to ask the question on your behalf.
But I think Laura Coffey put in questions and I don't know what they are.
Okay,
Sorry.
no problem. So I'll ask the first question on Laura's behalf was to all health professionals. Is your part of the NHS already overwhelmed? So I'll just come to Toby for a response on that one.
Yeah, thanks, Catherine. So at the moment, the NHS, as we've already described, various colleagues from different organisations, is incredibly busy, and we've been for several weeks operating at pretty much full capacity. That does not mean yet that the NHS in Northamptonshire is overwhelmed. The conversation they hear that we're having really openly today is that on the current levels in terms of potential growth of cases, and as Lucy rightly says, almost regardless of the severity question, the numbers here become so large, or are likely to become so large over the coming days and weeks, that will create a level of pressure that our concern, and we've really been open and levelling with people here today, our concern is that could tip us into a position where the NHS does become overwhelmed locally, and that's why we're doing the things that we are across health and care organisations, and why we need our local populations to do everything they can to help avoid us getting into that place, and to make sure, crucially, that those patients who either from a COVID point of view or for other emergency and life-threatening conditions need our support, that we are there for them through that. So not yet, but this conversation is about how do we make sure we don't end up in that place over the coming days and weeks. Thank you, Catherine.
Thank you. I think we'll take one more. So I'll come back, Carly, I'll come back to you for one of your other questions, if you'd like to take that offer.
Hi, yes, please. Thank you. So Lucy, if possible, yeah, we just wanted to kind of ask your view on the restrictions at the moment, and whether you think they are starting to help reduce the spread, and whether do you think they need to be tighter, and whether you're expecting those restrictions to be tightened.
Hi, thanks for your question. It's one of those crystal ball moments, isn't it? I have no idea what to expect from a point of view of next steps as outlined by central government. What we do know, obviously, is that restrictions do have a positive impact. We do know, though, that it is just one of the tools that we have available to ourselves, and actually regular lateral flow testing, if we don't have symptoms, PCR testing, and isolating if you're an identified case. Obviously the vaccination, but also just the basics around face coverings, hand washing and social distancing are all effective, and they're things that we should all be exercising. So, no idea what will be next. Yes, we do know they work. Do we want to see more imposed? No. But let's be honest, that's within our gift, isn't it? If we exercise and use all of the tools that we've got in our toolbox, we may indeed be able to avoid further restrictions, and therefore have the Christmas that we were looking forward to next week.
Thank you, Lucy. We are nearly at 12 o'clock. I'm conscious that many of our panel have additional meetings to go to, so I'm going to bring the meeting to a close. I'd just like to ask media colleagues who've not had their questions answered, we're more than happy to follow those up with you afterwards, so do get in touch with us. So I'd like to give my thanks to all of our panel members and their comms colleagues behind the scenes for giving up their time to support today's event. I'd also like to thank our media colleagues for joining and for their support in sharing our key messages at a very important time. Do follow the guidance on offer from our colleagues. Look after yourselves and each other. Stay safe, and I wish you a very Merry Christmas and a Happy New Year. Thank you.
Thanks, everyone.
Thanks all.